Morning, everybody. Thank you for joining us so far. I'm going to give a little more time for folks to come on. Yes, hello, Lori. Welcome, and we will be starting very soon. We did figure out how to mute everyone, so thank you, Sam. And we will be muting folks as they come on, so we shouldn't have too many distractions. But I'll let folks come on, get settled, check your speakers, do all of your morning rituals for webinars, and settle in because we've got some good stuff for you. Greetings and good morning. We are still having people sign on, but we're happy to start. It's about 10:02. And I'm going to turn my phone off so that nothing bugs us. And we will be starting now. And we will be talking today about the Excel data templates that DHCS has quite a few of. They're programmatic based, and you've probably seen them. So next slide. I'm Amy Peterson, and the staff that are helping with all of this, the webinar series, I include Atif Habib, Samantha Van, Emma Ane Herrero, Abby Geber Salasi, Brianna Stali, and Soo Jung Kim. And all of these folks are working hard to put webinar content up on the web from EDM and from PDRD and mostly HIMD. Those are the divisions that are providing most of the staff and information for this particular webinar. Today's speakers are me, but also I'm going to introduce you to some folks. Sarah Reed is a really just a really good subject matter expert when it comes to data collection, especially on the Excel data templates. And we have Jeff Jennings, who is our documentation guru, essentially, but he'll be speaking to you a little bit about the Data Documentation Center. Next slide, please. For general questions and answers, and for some reason my slide is like, is the slide showing to everybody? Okay. For general questions and answers, please go ahead and submit your question to the WebEx chat. And you can go ahead and send it. We'll answer them as they come in if we can. Otherwise, we'll get to them and we'll find you a subject matter expert who can answer those questions. Those questions do get added to our frequently asked questions document that's posted on our webinar page. And any specific questions, if you send to the data mailbox as what will come up later in the instructions, that information will get to the right people we'll get it to the right people too if you send it directly to us, but your specific questions specific to your needs will be answered and addressed. Next slide. So this is a little interactive. Why is template data collected and how is it used? So in the chat, I'd like you to, as I'm talking, maybe think about why we would use Excel data templates to collect data from managed care plans and all the different plans, and what we probably use it for. So as we move through this first topic section, be thinking about that. And you can put it in the chat if you have ideas. Otherwise, I'm gonna tell you some of the things that we collected for. Next slide, please. So the data quality monitoring standards and objectives today, we already talked about. Why Excel data is collected, how is it used? You're gonna be putting stuff in the chat. We're going to present some challenges in the future of Excel data templates. So kind of describing what kinds of things they see as the data comes in. And then again, we'll have Jeff talk to you about the Data Documentation Center. I'll go over communication resources and any next steps. But you should also know that this is the last webinar of the 2023-2024 year. We started in April of 2023 and we have made it through. April will be, this coming April, next month, will be the next big, okay, how are we doing kind of year-end anniversary. So again, why Excel templates? Some folks have been putting information in the web chat, but it's universal. I mean, people use Microsoft Excel, so it's accessible. Data template introduction, it's kind of like a way to say, hey, this data is not being collected yet. We need it. What is a way to get it quickly? So we use it a lot for like novel data or pilot data. And then it can be prepped for transition to a more permanent data collection. Designing the data templates, it helps us figure out what's possible to capture or how to ask it. So it's kind of like it can be used kind of temporarily as a survey tool almost, and then figure out what's the best way to bring this data in, what are the best ways to gather this data. And it's led by program needs. So program will say, we need to collect this data. And we'll say, hey, we have demographic data, we have enrollment data, we have claims data, but we don't have that data. So how do you want to do this? And they'll guide us through whatever the policy or authority is to collect that data. And they'll ask their specific questions, and we'll be able to help them design a product that will fit that need. And the advantages of data templates include helping us organize that data, gives us data to analyze. Somebody said that. It enhances transparency because we can report out on the data, and it allows time for data to mature. And what I mean by that is plans, sometimes it takes a while to be able to like understand how to collect and report out the data. And it gives us time to plan for a transition if that data is going to be a permanent fixture in our warehouse. We can determine how to make it, and it takes time. So it gives us a chance to collect data in the interim, and that may be temporary, maybe 7 years, but that data then can be rolled up into what we collect in the data warehouse. Or we might determine that, hey, we're not collecting it right in the data warehouse. We need to add some stuff. And we know because we've got data templates that give us this information as a guide. And so we can add to the data collection efforts. So the kinds of things that you can expect if you get an Excel spreadsheet, and you're going to get an announcement from a program. They're going to send out a letter or some kind of announcement, and you will be invited more than likely to a technical assistance webinar, and they will guide you through what the expectations are about what the data is that they're attempting to collect and gather. So they'll give you all that information on the first page. It's like a README page. So it'll be an introduction to the reasoning behind the collection of the data. And it will be like a paragraph about the why, and then information about where to put it. So it might be an SFTP, as a secure file transfer protocol folder that you'd have available to you. Or it could be an email if it's not collecting secure data, PHI. It might just be collecting counts or NPI data. So then it can be emailed. But depending on their needs, they're going to give the collection route. And then they will have any special highlighted, like, hey, calling this out, you need to do this. And it will have variable lists. So it'll have like a column and a name, and then it will have a definition. So essentially data dictionaries. So every tab on that worksheet will have its own separate data dictionary. And each one of those tabs, depending on how big the data collection is, should have some kind of way to link that data to the previous information, and then also into data that we already collect in the warehouse. So a tab labeled by a programmatic measure would be something like a plan code, plan name. So you have like a programmatic measure, and then each one will have some basic data that's included, like a plan code name, plan name, county where this data was collected from, or where the services were provided, and then the count, or it could actually be patient level. And that information is related to that program measure that they're looking at. So the data may be required in an aggregated form, like a count, or disaggregated by a SIN, or by MPI, which is not as, that's not as secure. Okay, so the next slide that we're talking about is an example slide, and I just took a few screenshots just to kind of make you aware, like, yeah, there's color changes. It's a little bit, it's a typical Excel spreadsheet. So the first thing will be instructions. So the instructions will be on your first tab here. If you look down at the slide, it's a red instruction sheet. And then we're looking at the CBAS, which is the community-based adult services. And those, we collect information on CBAS, but we don't have we are not collecting information in the warehouse for certain specific issues. So we may need, the program has determined that we need information that is being collected in those tabs. And it goes on to the right, but there's just a few here. So I screenshotted, so you could see that there's a plan code, column A. Column A is going to be plan code. Pretty much every single one of those tabs is going to have a column A plan code. Plan name, column B. Each tab is going to have column B. And you'll get all of this information in the technical assistance webinar that program would design and provide for you. So just to kind of give an overview about what an actual template would look like. And then later, Sarah Reed will go over some of the stuff that when she's designing the templates and when she's collecting the data, the information that maybe comes in a little wonky, and she does a lot of the work to get that information cleared up. So as you scroll down on that first instruction page, it will give you more and more information. Each tab has a data dictionary highlighted on that page, and it just gives you information about what the expectation is, how to put it in. And then again, that first paragraph even tells you whether or not it's quarterly or monthly, when the due date is. So you have all the information right there. And then if you need more, if you need help, if you need to find it, you can always email your contact and somebody will hunt it. If you said, I need the CBAS template, I lost it. I mean, I don't know. But if it goes missing or you can't find it or it's named something else, you can get that. You can get a blank one sent to you. Okay, next slide. So we have a list of a lot of the current Excel data templates that we know about. We know that they're in managed care, data quality and monitoring division, managed care operations division, and also in there's some for quality and health management. The population health management team has at least one I know of. It's the DSNP. It's the DSNP template. So let's take a look. We've got a major organ transplant. That one's current. Its frequency is annual. So that would be something that you put on your calendar annually. And again, your contact for that would be an MCQMD. There's a SNF, it's annual, also MCQMD, CBAS, that would come to HIMD, it's quarterly, and it goes through the data exchange, and you would just want to mark your care of the DCU so they can find it and get it to them really quick, because that's a pretty general resource email box, but as long as they know what you're looking for, they can get it to the right people. So the dual and special needs plans, the DSNP quarterly, that one also care of DCU. The dual special needs plan annual, also DCU, and the dual special needs plan mild cognitive impairment, also DCU. Next slide. And then we have the ECMCS template. That one, that's relatively new. That one's care of DCU. Again, you can see there's a data collection unit that's collecting this information, and they do a lot. The managed care program annual report, the critical incidences or incidents, the MCPAR CI, that is also care of DCU. The managed long-term services and supports, or MLTSS, that's DCU. Non-medical transportation and non-emergency medical transportation, those are real mouthfuls. NMT, NEMT, DCU. Population health management, key performance indicators, DCU. That's another pop health one. The whole child model, also DCU. So the newer ones that we've been kind of working with a lot are ECMCS. There's a business requirement for monitoring compliance, kind of get an idea of what they need it for. The frequency of collection is quarterly. Program contact is CalAIM, ECM, ILOS@dhcs.gov. This will be a live link in the final slides when they're produced and posted on the web. There is no plan for revisions. There was a recent revised one to include new plan codes for 2024, but otherwise no upcoming revisions. In the process of being converted to a JSON file format, and they're actually in this phase where they're producing the template and they're producing a JSON file test file. So they're like doing kind of simultaneous reporting right now to kind of make sure that they can get everything into the warehouse. So that's one of the ways to use a template. It's to validate what's coming into the warehouse. Okay, so let's go to the next slide. MCPAR critical incidents. This is one that I'm not super familiar with, but the MCPAR is the managed care program annual report, and they're collecting data on physical health, behavioral health, dental care, all of that information. And this year I think all three came out, and this critical incidents report is being collected on template. Critical incidents. It's coming into MCQMD. I have a coach. So the program contact is MCQMD, and again, no upcoming revisions. This one is quarterly. Okay, next slide. The DSNP, like this one I'm really familiar with. CMS requires a variety of care coordination and quality reporting from the DSNPs, the dual special needs POPs, the plans. And the frequency of collection is quarterly. So right now, I think they're still kind of working out getting things really clean and valid, and that's part of this whole template process, is to just make sure that data is coming in and it's usable and that it reflects the actual services being done. So the program contact is quality and health equity div, and that's a whole division at dhcs.ca.gov. This will be a live link, and there are no upcoming revisions to that template. Next slide. Okay, I would really love to introduce you to one of the folks that I've worked with the longest here at DHCS. This is Sarah Reed. She's a research data specialist in the data collection unit. Incredible resource and subject matter expert, but please do not inundate her with questions. You can do it in the chat, but don't send her tons of emails yet. She's got a lot to tell you about the kind of data that she sees on a routine basis coming in on the templates themselves, and what she does to kind of assess and work through it with the plans. All right. Sarah, are you here?
Yes, I am. Hello.
Hello. Okay, I'm going to stop my video and let you go. Welcome.
Let's go ahead and move to the next slide so I can get started. Okay, so Amy did a wonderful job telling you why we use these Excel templates. The problem is these templates, well, are not without some issues. One of the biggest problems with Excel is that the formatting can just be overwritten. And this is one of the major challenges with using these templates and working with the plans is I put in a whole lot of different data validations and securities into these templates so that only the right information gets put in. But if you copy and paste text from a different Excel file and you paste it in without doing plain text, it copies the formatting of the other template or the other file over the template. And so it erases everything in the template. And so that's how I can get, unfortunately, data in that is not correct because maybe columns are in the wrong order, or just there's a variety of issues, and I'll talk about those in a moment. So this is one of the biggest challenges that we have, for as much as we try to make these templates secure and locked down so that, you know, numbers go in the number columns and those type of things. It is very easy to just undo all of that with how copy and paste works. The other thing that we have a lot of challenge with on both the plan side and DHCS side is this is a whole manual process, everything about it. On the plan side, they're doing manual entry. That can result in errors. For me, most of these I review manually, so I'm just using my eyeballs to look through all these templates and trying to find errors. Now, some of them we do have code for, and that reviews them, but some of these templates don't have that. And of course, this can result in errors. And most of this is compiled manually here at DHCS, so we're copying and pasting from all the individual MCP files into a master file so that it can be utilized in, you know, all our analysis and dashboarding and making graphs and things. And because that's a manual process, we can mess up too. The other really big challenge is right now, Excel is not machine friendly. It's not readable. We can't just, you know, feed it into the warehouse or other systems very easily. Sometimes it can be used with SAS, but it usually needs a lot of cleanup to make it readable by these programs. So it's very limited right now in how we can use the data. Next slide, please. So let me go into a little bit more detail on what some of the most common errors I get are, and that is blank cells. Most of the data elements will require something. It's all specified on the instruction tab, like Amy said. There are some exceptions. I'll give an example, like there's a disenrollment date and a disenrollment reason. Well, if the member hasn't been disenrolled, then both those columns would be blank because they're still enrolled in the program. However, once they are disenrolled, then there would need to be both a disenrollment date and a disenrollment reason. But otherwise, those columns will be blank. Everywhere else, it should be filled in. And when there is numeric data and there's nothing to report, we need 0 to be entered to know that it wasn't just missed or, forgotten. We need confirmation that the plan knows that they have no data, and so therefore they put 0 in there. And the other thing is when we have data where there's a plan name, plan code, and county, and whether you're doing aggregated or SIN level, we need that type of information repeated on every row. And again, it comes back to how we have to use this data in a very manual process to aggregate it and use it in dashboards and reports and the like. We need that identifying information on every row of data. We also have some problems where if, because maybe an MCP is copying from a different Excel file into the template, columns of data could be in a different order. And so maybe the plan code and the county get mixed up. And so they're not where they're supposed to be in the template because they were in a different order in the source document. Also, it's very easy just to have the wrong reporting period. That is a drop-down menu, and it usually gets set for years in advance because we don't want to have to continually revise the template and resend it out. So it's very easy to choose, Q1 of 2023 when you meant to grab Q1 2024. And then lastly, the file naming convention. The instructions tab specifies how to name the files. And I know from a lot of other people's perspectives, this doesn't seem like a big deal, but for us, because we're dealing with so many files from so many different plans, we need these files to be appropriately named so that when we're, looking at 25 different files on our drives, we know whose is who and what is what. And one of the biggest things that get left off is the MCP name. I know you all know what your name is, and I know that too, but when it gets all dumped into one file, one folder, we need each file to be named so we know what data to look at. Next slide, please. So one of the things we're looking at right now is the future. And we know that there will probably always be a need for Excel templates because they serve a short-term purpose of getting data quick, but we're trying to limit that they don't go into long-term usage because then we continue to have data errors, and we want to improve our data quality and reduce, the manual process of it. So as Amy said, for the ECMCS, we are in the process of converting it to JSON, which is a machine readable format. So it's not even going to be looked at by human eyes. It's going to be loaded right into the warehouse and be made available to use and review in a much better way. And even then, we're still looking at other potential options to collect this data that might have better data validations than Excel. Because again, that's one of the biggest problems is that it can just be easily overwritten. But we also want to make sure as we look into these alternate methods like surveys or forms, that they don't put a bigger burden on the plans to fill in this alternative format. So any changes that we make will be well, shared, discussed. We're not just going to flip a switch and all of a sudden everybody's going to be filling out SurveyMonkey forms because we know that's not going to work for a lot of things, but we are trying to figure out what better ways can we use for these that need to still be in this more manual process that we can't necessarily convert to JSON since that process can take several years to just translate one template. So these are the things that we're looking into for the future. And I think that's it for me. I will hand it over to Jeff.
Thanks, Sarah.
Yeah, great job, Sarah. Thank you very much. Okay, well, really my part is kind of the usual boilerplate about using the documentation center to obtain companion guides, technical guides, other artifacts that are related to data submission, etc. I do have a little bit of news about the templates we're discussing today and in addition to the Documentation Center. But first, we'll kind of just work through this. As I mentioned, the Documentation Center is our latest solution for sharing files easily. It works for the majority of our trading partners. When there are exceptions, we have alternate ways of sharing information with you, documentation and otherwise. Should that be a need, please send an email to dataexchange@dhcs.ca.gov and we'll help you get the materials you're looking for. Next slide. So most of the files that are, most of the information, files, documentation that's out there right now is oriented towards managed care trading partners and are related to systems like Catman or PACES. For behavioral health plans, county plans, the short Doyle BHIS area continues to host the short Doyle companion guides and other documentation that's specific to those processing systems. As we start to integrate the two areas more completely, we'll add documentation to the Doc Center depending on what is most convenient for all of our trading partners. BHIS is still there, so for county related items, short Doyle related items, please see BHIS. And then I mentioned we just have a new channel, and Sarah has gone ahead and created a channel called the DCU Excel Data Templates channel, and that contains primarily examples, instructions, and other templates related to these Excel spreadsheets that are being discussed. So for those of you with access to the Doc Center, you should see that once you log on. You should see that folder available and any of the information in it. Again, if you have any questions, need for access, troubleshooting, etc., please use the data exchange at dhcs.ca.gov address. And that's my update for today. Thank you so much.
Thanks so much, Jeff. I'm going to go ahead and talk about communication. I did see a question come in just now related to submitting reporting. That might be specific. It wasn't something that I was familiar with, so it might be something we have to do a little bit of investigation and get you a subject matter expert. But thank you for putting it in the chat. Okay, there are quite a few data group mailboxes that you would want to know about for this regular webinar, but here at this one for the data templates, you just need two. You need the data exchange at dhcs.ca.gov. That's going to get you into Documentation Center access requests. You can ask for access for Excel data template questions that Sarah Reed just presented information about. You want that same data exchange at DHCS, but you want to reference DCU in the subject, and then you can ask your question about the specific template. For Excel data template questions that MCQMD handles, please do contact MCQMD at dhcs.ca.gov. Use that handy dandy little list that was previously in this webinar. And these webinars are posted on our webpage. If you have an urgent question, please mark urgent in your subject. So it would be like DCU urgent. And then again, for us at the webinar series folks, we are MCDSS at dhcs.ca.gov. All of the links in this webinar should be live when it is posted up on the web page, and a transcript will be provided, as well as a link to be able to view the whole shebang. You can watch the entire thing like a lecture. Okay, so next steps. We are in production or in the testing phase with counties for a couple of these things. Do you mind moving your little cursor over and pull it out? Oh, maybe it's mine. Never mind, it was mine. I was blocking something. Okay, so the data transaction types versus where they are in the process, we're in production for pretty much everything. We are in the testing phase for counties for the 274 drug Medi-Cal organized delivery systems, or DMC ODS. So that's the only one that's still not fully fledged, but the rest are in production. Next slide. Again, resources. So I've been talking about the webinar series webpage. There's a couple of places on the website at DHCS where you can find really good information about the quality measures and reporting. It links you straight into our webpage series if you want, or you can scroll down and look at other information related to quality measures and reporting. But the DHCS quality webinar, the DHCS quality webinar series webpage is hosted here, and you can go back and forth from the webpage to see. Next slide. So it goes back and forth. You can toggle back and forth and look at different things. But the webinar series is listed out by year. So we have a 2024 webinar schedule. Again, our year starts in April because we were tasked with this last year around that time. And it was originally a quarterly project that went monthly. So the Managed Care Data Quality Monitoring webinar series has a ton of information related to frequently asked questions. There's a glossary of terms. We always provide a recording and script. In the PowerPoint slide decks, we'll have live links, and you can now subscribe or unsubscribe, which I have been wanting to do for a while, but we figured out how to do that. So you can subscribe yourself to the listserv and take yourself off or take your staff off. Frequently asked questions is really key because it's a really nice place to go when you have something really quick and you want to double check it and you don't want to listen to the entire webinar. The glossary of terms is really handy, I know for me, because the acronyms and all of the other terms of art used at DHCS can be very detailed, and if you come from lots of different places, it's the same acronyms with a different meaning. So it's good to have. Okay, next slide. The webinar schedule. So again, we're finishing up this year. Yay. This year has been pretty exciting. We've published now 12 webinars up on the web, and they're useful for training and accessing information. We've tried to create a really robust project and resource for everyone who needs it. Next month is going to be the annual address, which is the anniversary of this entire series. In May, again, we're going to cover some 274 medical managed care provider data. And then in June, the MHPs, and then July, semi-annual data checks, and August, encounter data. Let's go to the next slide. September, we'll continue with 274 dental. October will be monthly data checks. November, DMC ODS. December, MCPD, PCPA files, any expansion. January, semi-annual data checks. February, behavioral health short Doyle. And then March would be, again, currently, we would be talking about any maybe newer or updated Excel templates, or even provide you with some information that might be from a different area of DHCS. So one of the things that we plan to do in April, which is the annual address, is have you submit a survey to tell us like what's the most helpful way of what in the webinars that we provide is the most helpful to you as active users. What is some of the audience information, like who's really using it? Things like that are going to be in this survey. We're going to try to get it out in April and hopefully give a couple weeks to have folks participate in and get some interactive use out of this and just get some feedback about the webinar, the series itself, and what you find the most helpful to you as you provide services and information to your staff or need to answer questions yourself related to DHCS requirements. So those are the kinds of things that we would love a little feedback on and be able to report back to you in the April annual report. If you have any questions, we would be happy to take them in the chat. And let me go into chat now and take a look at what we've got. Why can't I get into my chat? Oh, is that it? That's it. It's a very easy little icon at the bottom there. WebEx is not the one that I use the most, but it does have all of the little special information at the bottom. So if you're looking for it too, it's down there. A lot of questions about where we can go for the webinars, tracking purposes. Yes, yes. Consistent format, exactly. People were responding and answering to my questions about like, what do you think we use the templates for? So using Excel for easier data manipulation. Yeah, but again, it's all manual, so we have to be very careful. And everyone using the same format, yes. Yes, we will be sharing this slide deck. Again, we will publish them at that webinar webpage that's been posted. And then Mimi had asked a question about previous month's offset reports. That I am not familiar with, but it's something that we will look into and figure that out for you, Mimi. So we will get that to you. As long as we have your email address, we can get that to you. You can also send that to the MCDSS. Yeah, Daniel, thank you. Excel VBA. That would be really helpful. It takes a little bit of training. Sarah's one person right now, maybe two. And then it would be handy to like be able to write the back code for doing the validation. I agree. Let's see, previous months off. So again, Mimi, we'll get back to you. Are there any other questions or comments or suggestions? We would love to see that here. I would give a few more minutes, but otherwise I'm gonna probably give your time back. Let's see, if you know of a program. Oh yeah, Sue is answering questions too about relevant experts. Exactly. So mcdss@dhcs.ca.gov, that we'll hunt them down for you if you can't find them. But a lot of the webinar pages actually have the contacts that you need and the context. Any other questions? Well, if you have them, go ahead and send them to mcdss@dhcs.ca.gov, and we will get back to you then. Thank you so much for your time. We appreciate your participation, and please go on with your day. Have a lovely one. Take care.